Are you suffering from chronic pain? Are you facing a diagnosis that you're going to hurt in your body for the rest of your life, or for years to come, or even for months to come? Are you facing the outcome of a disease or an injury that's going to change the way you can live the rest of your life? I'm sorry. My name is Wendy Keller, and in March of 1991, I was in a dreadful car accident. The doctors said they'd probably have to amputate my left leg because it was so damaged and it wasn't coming back. After a long time, the nerves started to reconnect and they said, okay, but you probably won't ever walk normally. You'll always have a limp. You'll probably always drag your leg behind you. I was 26 years old in excruciating physical and psychological pain. I didn't want that to be my life. So I started researching how those of us who are faced with a pain diagnosis can cope, how we can get through the minute-by-minute concentration that it takes, the diverting of our internal energy, just so we don't run screaming out of the room or limp screaming out of the room. I'm going to give you the 7 tools today that I used that helped me get to the place where I could cope with the pain in a way that had more positive than negative. It is possible. Maybe you'll find some of these useful for you. The first thing, and a lot of us don't want this, is get your real diagnosis from your doctor. Get what he or she really expects for your future. Ask the questions you don't want to ask. Listen to the answers you don't want to hear. You have to know where you start in order to know where you can go. It's your responsibility. You can't delegate it to anybody. Get clear. Second point is this: research alternatives. People have probably been dealing with whatever you're facing for hundreds or thousands of years. Well, you probably don't want leeches put on you like they used to do in the old days. There are probably systems, homeopathic, Chinese herbs, chiropractors, acupuncture, all kinds of things that you could use to relieve the pain or even perhaps heal the core issue. I don't know your situation. Look for alternative doctors, look for alternative treatments, and have the courage to experiment. Don't let your depression and your anger and your frustration over what the doctor has told you to be the death sentence for the quality of the rest of your life. Talk to other patients. Talk to other survivors. Talk to people who have tried those alternative therapies and listen to their answer. I'm not saying skip what your doctor is telling you. I'm talking about supplementing it. Number 3, do your exercises. Do them. When I was suffering, I was given a physical therapist who told me to do certain things, and I didn't want to do them. I just wanted to lie there and feel sorry for myself and angry at the unfairness of the world and of my fate. I was in a terrible bad mood. Maybe you can relate. In that mood, the therapist would say, you got to do this 10 times, and it would hurt after 2 or 3, and I would say, no, I'm not doing anymore. And I began to give up on myself and on my body. And then it occurred to me that if I gave up, there was no one who could help me. The therapist wasn't going to help me. The doctors weren't going to help me. And all I was doing was getting more bitter, more angry, and experiencing more pain and limitation. So I decided to do the opposite. And sure enough, it worked. Instead of doing 10, I'd do 12. Instead of doing 12, I'd do 14. Over time, gradually and consciously being careful of my own limits, I began to push myself. I learned this in college. I worked in gyms in college, and I would see these giant bodybuilders, and they would lift these weights. And if they could lift 20, the next week they'd try to lift 21 or try to lift 22. And slowly, incrementally, rationally, without killing themselves, they would increase what they were capable of doing. If you do only the exercises that your therapist has recommended, you will probably not proceed very quickly. Just add one more, just one. And when it comes to what the doctors and the therapists are telling you, do what they're telling you. Take the pills. Do the things you're supposed to do to get better. They may have knowledge that you don't, and there may be more hope than you think there is right now. I promise. The third thing to do is to take the pills and do the exercises. The fourth thing is look at your painkiller use. You really need to think about this. It's so easy to become depressed and become addicted to them. I know. When I was in the hospital, I had a morphine drip on an IV, but since I couldn't turn my head, I was allowed to administer it with my own little button that I could hold in my right hand, which wasn't injured. Everything on my left side was injured. I couldn't roll over by myself. So I thought, whenever I'm in pain, I'm pushing this morphine button to give myself an injection. I didn't know it had a timer, and I didn't know the timer would time out after a certain amount of times I pushed the button. So the nurse came in one day and she said to me, "All right, darling, do you think you've pushed the button today?" And I said, "Yes, 8 or 9 times. The pain has been bad today." And she said, "Well, it has a counter. You've pressed it 384 times. Really? Are you kidding me? I must have been sitting there doing this, not even conscious of what I was doing. I'm not saying we have to be Superman and stop cold turkey using painkillers. I'm saying that a dependence on painkillers can dull your mind and your ability to take responsibility for your own recovery. Only you know your situation, but why don't you see if you can go an extra 10 minutes on your painkiller? If they said take it every 4 hours, why don't you see if you can go 4 hours and 10 minutes, and then 4 hours and 20 minutes, and then 4.5 hours? Build your muscle. Take back control of your mind. Pain is a psychological reaction. See if you can be stronger than that. Challenge yourself physically and mentally to take responsibility for this. Now, I know that when we're hospital patients or suffering from some serious thing, we get scared and we give our bodies over to the healthcare professionals. It makes their job easier. In this case, don't do that. Take responsibility yourself for your wellness and your recovery. You must take your own responsibility. And that's the way you're going to figure out, step 5, what you can do. When you start to push the limits, step 5 is to figure out what you've got left. What can you do? How far can you go? How many exercises can you do? When I lost all use of my left hand and I'm left-handed, I figured out that possibly I could practice printing with my right hand and then even cursive. It became possible for me to write legibly with both hands, and it still is because of what I went through. You probably have things you can't do anymore because of the pain. And maybe it breaks your heart that you can't do things you used to love. What can you do that's close to it? Or what can you do at all? We've all seen these people who are playing basketball in a wheelchair, and they loved basketball before they were injured. We've seen people who achieve amazing things despite their physical problems. Why can't that be you? Step number 6 is to look for heroes. I have 3 people I'd like to bring to your attention who suffered physically more than either of us have. The first is my friend Sean Stevenson. That's Sean, S-E-A-N, Stevenson, S-T-E-P-H-E-N-S-O-N. Sean is a little tiny guy who has a birth defect. He's probably not 3 feet tall, but he can't stand up, so I guess we don't know. He has a normal-sized head, but his body is that of a 6-month-old baby, maybe. He lives in a wheelchair. This man got married last year. He's a motivational speaker. He's an incredible example of what's possible. Then there's my friend W. Mitchell, who has had, so many problems. His body was burned when his motorcycle slid underneath a truck. He went on to grow an extremely successful business and marry a beauty queen. And then he was in a plane crash, his own plane, and he became paralyzed. He's permanently in a wheelchair in huge amounts of pain. He happens to be a motivational speaker too. Look up W. Mitchell. Look up Sean Stevenson. These people have deeply suffered. They are in constant pain to this day, and yet they're doing things with their lives. The final one is Christopher Reeve. Look at what he was able to do. What an amazing man at the top of his life. And then that equestrian accident when he fell off the horse and hurt his vertebrae and became paraplegic. Look at what he was still able to do. These people are not miracle workers. They might be heroic, but they're just a little bit further ahead of you because they learned to use their minds to create and transform and to focus on what they have left. and to find out how far their broken and painful bodies can go now. You can do the same thing. I promise you, you can. I'm a normal person and I was able to do amazing things despite the pain. After 3 years, I had a corrective surgery. I am no longer in pain and I've returned to being athletic. Why can't you push yourself? Why can't you take mental responsibility? You can. And the final thing is, the 7th point is this: force yourself to be grateful for what you have left. Force yourself to be grateful for the people around you who are helping you and taking care of you and who care about you. Force yourself for your ability to hear or see or both this video. Force yourself that you have good medical care and you live in a country where you have a life expectancy. Force yourself to realize that if you had had this problem 500 years ago, you'd probably be dead by now, even if you don't think that'd be such a bad idea given how you feel right now. Look for what's possible. Look for what you can do and celebrate and focus on gratitude for that. What you focus on grows in your reality. So if you start to focus on, well, I can't use my left hand, but I can use my right and I can learn new things. Or I can't use either arm, but I can still use my feet. Or I'm in constant pain except when I'm sleeping. Look for the things you can do. Look for the things you can be grateful for. And slowly, so slowly, you'll find that your body and your mind are changing with your attitude. Sincerely, I wish you the best of health and the best of luck as you go through this time in your life. Thank you for watching. I'm Wendy Keller. Bye-bye.